How's it going, guys? This is Mike. What I got for you today is my bug out bag uh, trauma kit. Um, I have another video on my basic first aid kit. This is looking at there's not, you are their last hope. There's no hospital. You are the hospital. Hopefully it never comes down to that, but that's what we're preparing for just in case. Uh, I'm not a doctor. I'm not a trained medically in any way. I have taken uh, at least 8 years of first aid uh, training, CPR training, and AED training. I've watched a lot of videos online, uh, and I know that sounds kind of corny for reference, but there's a lot of good information out there. I've also read quite a few books on medical preparedness and how to do a lot of procedures. Hopefully I never have to do this. Some of the stuff I'm going to say is going to be kind of out there for some people. They're going to think, well, oh, you think you're a doctor, you're going to be able to do that. Well, if there's nobody there, if you don't do something, they die. So, I mean, those are your choices. You got to knuckle up and do it. So the best thing to do you can do now is prepare. One thing I will give a credit to a book that I read that was an awesome book about medical preparedness in a let's say a bug out situation or a end of the world situation, more or less. It was more about end of the world as we know it, is actually the way he put it. But he is a doctor. He wrote this book. He gives a lot of diagrams. He gives a lot of advice, and he puts a lot of videos online dealing with his book and what he discusses and shows you how to do it. Like he shows you how to suture an injury up, and how to tie the knots, and how to prepare your tools before you start. Those kind of things. He is very good, well educated, obviously. The name of the book is Doom to Gloom. No, I'm sorry. Doom to Bloom, because everything's better now. Okay, but I'll get on with it. This is what I got. If you do have any ideas or thoughts or how I can make this better, or if you think I got frivolous things in here or anything like that, comment. I would love to chat with you. Okay. What I have in the first pocket here, in these two pockets, are a couple individually wrapped surgical gloves. It's better to have them individually wrapped than touching all the other ones every time you get in there. This way you only touch the gloves that you're going to use. And in the trauma kit, we're talking about the other kit. My first aid kit was talking about bruises, lacerations, different things like that, nicks and cuts and bruises and sprains and strains, those kind of things. This is talking about major blood incidents, or gaping wounds, bad lacerations, broken bones, different things like that. Even asphyxia from, let's say, a bee sting, anaphylactic shock. We're talking about those kind of things, where if you don't do something, that person might die. Not everything that you're going to deal with this kit is life or death, but some of them are. Okay, I'll get on with it and stop yakking here. What I got in this front kit, I got Benadryl, anti-diarrheal medications, topical antibiotic creams, electrolyte tablets, electrolytes or what's in your Gatorade drink. Uh, so basically, if you needed to, let's say somebody that's in shock, somebody that's had a dehydration issue, something like that, they are going to a stroke, well, not well, heat stroke, things like that. They're going to need liquids, and it's even better to add the electrolytes to balance the body back out. So those are in there. I got, antiseptic wipes and for cleaning your fingernails out and your hands a little bit, getting blood off yourself afterwards, whatnot. And I also got alcohol wipes in there. Here I got a little mess of stuff here, but I don't have a lot of band-aids in here because this kit's not about that. But I do have a couple antibiotic larger band-aids. They're already impregnated with antibiotics, so those are nice. I got a fingertip band-aid in here and a couple regular sized, standard sized band-aids. But once again, there's not a lot of band-aids. There's also a bunch of steri strips in here for closing wounds without using stitches. They have a very nice adhesive on there, so they can deal with a little bit of blood being in there, and still stick and hold. So they're nice. They're nice for the especially for like the face. It's hard to do any kind of stitching or anything on the face, but anyway, those will really hold something closed, especially the face and the eyebrow and stuff like that. And they can hold long enough to make it so it heals without too much scarring. For wound closure, I have a styptic here. It's called Wound Seal. I haven't used it yet. I got 3 little packages in here. But basically, you have a wound that's bleeding and it won't stop bleeding, and you put pressure on it and it still won't bleed, because your first means of stopping bleeding is pressure with your hand or with a gauze and pressure. But if that doesn't work, something like this, you pour it right in there and it just basically helps bond and add a little bridge across to allow a nice clot to form, and it'll stop bleeding. So that's what that's for. You don't want to go to stitches or anything like that if you don't have to. You want to try to deal with it in another way. I have super glue here, crazy glue. Like I said on my other video, I have used this before, and it does work. Even with a bleeding wound, you can, even with that won't stop, you can still add this, and it's so powerful that it penetrates through the blood and doesn't allow that to get in it. It's not looking for the blood, it's looking for another, let's say a material, a mass to hold on to, which is the other side of the wound. And you pour it on here and it just goes. You pour it right through the middle and just push it together, and it just pushes the blood out of the way and seals it. That works well. And then obviously you put a little gauze on there, bandage it up. So that's why I have the super glue. And if you have a need for speed, you don't have time to deal with something, a big major time that it's going to take to deal with a wound, because you're in a bug out situation, maybe you're in an unsafe location and you need to get somewhere safer, you can put this on here to stop the bleeding, and it'll take care of it and close that wound for you nice and quick. And this one I'll save for later, but it's not super glue. Back here I have just a ton of 4x4 gauze. If you're bleeding with a major bleeding incident, you're going to need something to soak up and absorb that blood and get a clot going. You really and the biggest thing that you have to be aware of is once you put gauze on something, if it continues to bleed through, never take that first piece of gauze away and add a different piece, because all you did was any form of clotting that's starting to bridge across is gone now. It just came out with your gauze and you're starting with a fresh wound again. So never do that. You put a new piece of gauze on the old piece of gauze and apply pressure. That's how you deal with the bleeding incident. But I got a lot of them because and they're the 4x4s. If you have a blood incident, you might need a lot of them, so they're there. Here, actually, my little spacer came out just to keep it from falling in on itself under pressure or something and breaking. But a finger splint, nice little finger splint, goes back to about second knuckle, a little bit past that. That's something that if you have a break here or a laceration that you don't want them bending it and reopening it, you would put this over that gauze, tape it up, and now it's stable and it's not going anywhere. So that's basically what that's for. Next, I have a triangular bandage. It's probably 4x4. You take this out, and this is for basically a makeshift cast for, like, let's say an arm. Somebody broke their forearm, and then you take care of the forearm where you have to keep it immobilized. So you would take this triangular bandage, wrap it around, tie it around their neck, and they can't move it and add any stress to that fracture. Also, major bleeding on that arm. It doesn't even have to be broke, and you don't want it to reopen because they're moving around. You could stabilize that. So that's there. Here I got a little first aid kit that came with some of my first aid supplies. But basically what you have here is symptoms and treatments. They give you the symptoms, what you're looking for as their caretaker at the time. You're looking for the symptoms, and then they tell you how to treat it. It's the Cliff Note version. It's just they don't go into depth too much. You should already know these things if you're going to be a first aid responder. But there's some of the major hitters. They tell you what to do, and sadly, some of them say get with the doctor. We're talking about not being able to get with the doctor, so you're going to have to make your adjustments. Like, you might have to set a fracture. Until you do it, you don't know how well you're good, if you're good at it or not. Putting the puzzle piece back together at the end of the bone, but that's basically you might have to do that. I'll leave this for later. Okay, we're going to head to the back now. I have a bandana, basically used the same as your triangular bandage, but also this could be used for a tourniquet. This could be used to tie a splint to the body. So this has got a lot of uses. You should have at least one of them in there. Need be, it could be used as a bandage or a gauze to help stop bleeding. Inside here, I have a sterile gauze. This is kind of an inner gauze that's going to go directly on the gauze that you have on the blood. So that's what that's for. And then, like here, Mylar blanket. Everybody knows what it's for. Especially stress, dehydration, heat stroke, even. Or just to give somebody a little comfort of having a blanket over them. That's what this is for. And then obviously it's got all its other uses, but that's why that's there. Here's a supportive bandage. You got ace bandage. You got a strain, something like that. You're looking at an ankle maybe. This is to wrap that ankle and put some pressure on it, and help you get around a little better than if you didn't have it. Also, that pressure is a counter irritant to the pain that you're dealing with. That pressure, kind of, you feel the pressure more than the pain. So that's what that's for. Gives you support. Save that. But that's basically, that's what this is for. This is my heavy duty, thick, very thick, supportive, elastic bandage for the same thing. But this one can also be, like, let's say you had a trunk wound, a torso wound, and you already got your bandage and gauze on it. You need a little support. You wrap this around there. That's what this is for. This could also be used for a knee. You know, sky's the limit. It's up to you to figure out what it does. Got a headlamp. It's actually pretty bright. Pretty nice headlamp for the money. I like it a lot. It's small, compact, goes where it's got to go. But you start working on somebody, especially if it's dusk, at nighttime, anything like that, you got both hands free because you have this. It looks where you look. But not just that, during the daytime, you can use it to look for debris inside of a wound, anything like that. You know, obviously I got some more support and wrap. You can use these for both, support or wrap. But some more ace bandages, a thicker bandage. So I got quite a few of those in there. But they are basically there's a chance, a very good chance, that you'll get mechanical injuries like sprained ankles, sprained knee, things like that. You're going to want to wrap those up to feel better, to get some support on that joint. So that's why I got so many of those in there. That's really why, the mechanical injuries. But like I said, dual purpose, can also be used as wrap around the gauze and stuff like that. This right here, here's one of the areas where, sorry about that, here's one of the areas where I might get some complaints where people would think, you know, who are you to try this and all that. But I'm talking, you are the hospital. There's no ambulance coming. It's bug out time. You know what I mean? You might be out in the 15 miles out in the woods. There's nobody coming. And maybe the support systems out there, the society themselves, can't come because they've broken down. I don't want to get too radical or anything, but basically that's the point of my trauma kit. It's me taking care of somebody. Of course, I don't want to perform any of these, but I'm just saying this is an option to save someone's life. So, no further ado here. I'll stop whining. But this tube is basically for the airway. What I'm talking about is asphyxia. Let's say somebody has anaphylactic shock from a bee sting. Maybe they didn't even know they were allergic to bees. Maybe they weren't last year. But whatever. Maybe it's they tried a mushroom or a piece of food. They weren't good with crayfish. Whatever. And they get anaphylactic shock. Their throat is going to close up. And if it's a bad case, their throat's going to close totally up and they cannot breathe. There's different ways you can deal with that. You can sit there and shake them on the shoulder and wait till they suffocate and die. Hopefully that's not what people would do, but it does happen a lot. People just freeze up and they don't know what to do, or maybe they don't have the tools to do something. But that person needs air. Now, the way a lot of people will do it is they'll do a tracheotomy on the person, and they'll take a pin and stick it through their throat, right into their esophagus, and now they can breathe. Well, now that person is going to have a stoma for the rest of their life. Uh, you know, that's a last effort to start mutilating someone's body. That's last ditch effort for me. But if I had this, I could shove this through, force my way through the inflammation in the throat, and you're not even going that far, and you just go down, and then they can breathe until their episode is over. But at the same time, that's why I have Benadryl with me. That Benadryl is going to help them, even though if you don't have an EpiPen, it's the same stuff, man. Epinephrine, it's all the same stuff. But the problem is with Benadryl is it takes a while to get into your bloodstream, and it's weaker. Where a EpiPen is a straight shot, man, right into the leg. But anyway, that is my point with the tube. Okay, now we're down to the last couple items. What I have here, obviously, I'm a dork and I wrapped it up with a little bit of paracord here. But that paracord, once again, can be used for so many things in a medical situation. You know, you're talking tourniquet, you're talking a wrap, hold something, anything like that, add support. But the biggest thing I'm talking about here is the hand sanitizer. Your hand sanitizer should be the first thing you go to after you have diagnosed what you have to do with that patient. You're going to want to sterilize your hands, and I'm talking a major wound. You don't want to put any kind of bacteria or germs, fungi, anything like that into that wound. Dirt, grease, grime, anything. So, because in a bug out situation, we're probably not going to be the cleanest people around. So your fingernails are bad enough. They're going to be dirty if you don't keep them nice and clean, nice and cut. But you got to take care of this. Okay. Here's another thing that people might bitch about, but it is a true fact. It happens. There's so many kids that have died from it. Teenagers in their schools take this hand sanitizer and they get drunk. And what they do is they get drunk and they take too much of it and they die from alcohol overdose. The thing is, there's different types of alcohol. They've started changing a lot of the alcohols on purpose to make somebody sick instead of giving them a buzz. But what you're looking for is ethyl alcohol. What ethyl alcohol is alcohol. It's grain, basically like grain alcohol. But the difference here is this stuff, when it goes in your mouth, just starts dispersing, and it goes up through your palate and everything, and your tongue and everything in your mouth, and goes directly into your bloodstream. And that bloodstream goes directly to the brain. So you're instantly getting alcohol to the brain. Where if you take a beer and you drink it, it's got to go through your whole circulatory system before it gets back up to the brain. That's why sometimes you can be sitting there at the bar, and when you stand up, you about fall down. It's because it takes a while to get there, and you don't even feel it until afterwards. But anyway, my point with this is if you have to put sutures in somebody's gut, or you have to work on somebody's broken leg, or anything like that, pull a tooth, anything like that, you might want to you might want some kind of sedative, uh, and drug, and basically alcohol is a depressant, and a so it lowers everything, even your pain sensors. So you might want to use this in a situation where you have to do some type of minor surgery on someone, if you want to call it that, and you know they're not going to be able to take it, the pain. You know, good old boys back in the day used to go out and get each other drunk and pull each other's bad teeth. I mean, that's just it's been used for I can't even tell you how many years, probably thousands. But that's what you can use this for. But you have to be careful. And I'm not condoning it. I'm not telling you how the dosage or anything like that, because obviously different weights, different tolerances have a thing for that. But this is something that you should take a small. If that's what you're going to do, you would take a small dose of it and see what happens. And then you could take a little more if you need more. Obviously, you don't just guzzle this whole thing down. You might end up dead anyway. So, you know, there's a precaution there, and I'm telling you, it's up to you. I'm just giving you the option in a bug out situation, something that you could do. Okay. I have a bottle of iodine here. You have to, you know, every once in a while, once a year maybe, change this out. They say it does kind of get sterile and neutralized. So you might, chlorine does the same thing. That's why you want to just keep it up to date. But this right here is a lifesaver when it comes to bad trauma. Once you get the bleeding done, and before you start doing your stitching or however you're bandaging or anything like that, especially in a bug out situation where if somebody gets infected, they might die. So you would use this, and iodine has been used forever in the medical field. And as a second thing, you can, you know, it's 5 drops to a liter. You can also sterilize, you know, water that they might need to drink. But and also you sterilize your tools with this. You know it's on there because it stains it a reddish brown, and you would wipe it all the way around their wound and over their wound, and you would see that it's that you took care of the whole thing. In the back here, I got a couple of different size splints to immobilize people's wounds. I got another. This is just my little pack here of tools, but I have another pack of single sterile gloves. I have a pair of tweezers for if somebody has a wound, you might have to clean that wound out, and get pieces of foreign objects out of there. Just a pair of cloth cutting scissors. Cut some of this gauze, cut some of the bandages, anything like that. If you have, sorry guys, my battery died on me. If I have, you know, a razor in here in case the person you're working on is a big, you know, hairy beast, you know, and basically he's got a chest wound or a stomach wound, and he's just got a ton of hair. You don't want, and you have to suture him up. You do not want that hair getting into the wound as it's getting sutured up, because it will stay there, and it will be a foreign object that will, and your body will fight against it to get it out of there through infection. So and seepage and you know just oozing. So you have to get that off of there. That's why this is in here, just to take care of something like that. Just a pair of nail clippers. You might have to trim off some of the, if there's a jagged wound with just like a piece hanging out or something, you might have to clip that off. That's what this is in here for. And there's other uses, obviously. Lastly, in my little toolkit is a pair of hemostats. And I know some people are going to say, why do you have a surgical tool? Well, that's what I'm talking about here. This is a bug out bag, and I'm looking at taking care of somebody the best that I can. And the best I can is to have a pair of hemostats. If somebody has a a vein or artery or something, let's say they have a calf wound and they have a major vein or something that's open, you can tourniquet it and hope that it slows down enough with pressure, or you can just go right to the source and just clip it off, and it'll pinch it off and it'll stop bleeding while you work on the wound. Well, also, if you have a jagged, ugly wound, it'd be nice if all wounds were nice and straight, knife slit. But if it's a jagged wound, and you have to puzzle piece this thing back together, you might have to work on one area while another area is in your way. A piece of hanging meat or skin or fat, and you might have to grab that and just fold it over and flip it over to the side and let it stay while you work on this other area over here. So that's why that's in there. I'm not trying to be a doctor. That's the last of the tools. I'll go through this. This is in my kit because it's nice and compact, sticks in there. I think I paid $1 for this stupid thing. It doesn't take a lot, maybe a half a quart. I mean, it's not gonna, maybe a pint. Maybe that's what'll go in there. But the nice thing about it is it's got a squirt head on it. It has a squirt head on it. So not only can you use this in conjunction with some of my other items to give somebody water, so they can have water, depending on the situation they're in. They might need water very badly, dehydration or heat stroke or anything like that. But just might need water anyway for somebody else. So basically, it's for that purpose, to sterilize my water in, to store my water in for them, but also it can be used to purge a wound. If you have a wound and it's full of debris, you cannot stitch it up like that. If you do, it surely will get infected, and that person might lose a limb, they might die. So you have to clean a wound out if it's a dirty wound. If they walk into a stick and the stick impels them through the leg and they get tons of bark debris in there, it's going to hurt, but you got to purge that. This can be filled up with water, open the head here and spray, and that will flush out a wound. So it's a very good item to have, dual purpose. So along those lines are some of my last items. In here, I have some jute twine, just kind of holding it, making it quiet, but also for fire purposes, and I'll talk about that in a second. But in here, I have iodine tablets and iodine neutralizers. Nobody wants to drink iodine water. We all have, and it's nasty. And but so if you can make somebody's life easier, put some neutralizer in there for them. But you can also take these tablets, add them to the water in here, and flush. Don't put the neutralizer in there. Leave the iodine in there and flush a already a wound that stopped bleeding. You can clean it out and you can flush it with this, or you can just add some yourself with this. You know, I'm just saying, if you're flushing, might as well do a good job and flush it with something good. So those are in there. Once again, you can take iodine tablets, add water to them, clean, good water, and make a paste out of it that is iodine, and you can use it just like that bottle of iodine. So just a little reminder on that little thing. And then in the back here, oh, I think I took it out. A goodly portion of aluminum foil, just in case you don't have a container that you could boil water in. If you had to go to the creek and get water, you don't want to flush the wound with creek water, obviously. You don't want to, so if all you have with you at the time is this, you can boil some water, let it cool off, then flush it with clean water. Same for drinking. You can do that for them. These are just all options. In here, I have a couple packs of sutures. These sutures are self-dissolving sutures. If you have a choice between the two, you would want to go with the dissolving sutures in a bug out situation, because it can be used the way a regular suture can be used, but it can also be used the way you would use a dissolving one for. So this is dual purpose. You would want to do that, because you're not going to have room for everything, and why have both if one can do what both can do? Okay, but anyway, the sutures, if you have a wound that is deep and maybe jagged, or even just deep, you have to assess the situation, and you cannot just sew it up, because what you might do is leave a recess, an abscess inside, and you leave that in there. That's going to fill up, and that's going to become infected, guaranteed. You cannot just sew up a giant wound on the top and hope the middle works, because it will get infected and that person will lose that leg, or you might have to work on that same wound again, open it up and start taking care of it. So that person could even die. So what you need to do is assess the situation. If it's deep enough, it goes through layers of fat and some tissue, and then it goes through some muscle again. And when you put it together, if it's not going to, the walls of the cut are not going to just mesh in the middle so you can sew the top. If there's going to be an abscess, you're going to have to put a second row of sutures, and that's where the self-dissolving sutures come into play. Because the nice thing is even in a regular suturing situation, you never have to touch it again. They just fall off and they dissolve and just start falling off and pull out. Okay? So you never have to touch them again. But on the inside of the body, you don't want to put something that stays there forever, because it itself can maybe one day cause a problem, an abscess. So you want to put the dissolving sutures, suture up the bottom layer inside and get that, and then go to the top and suture the top. Okay, that's just a little thing that I've learned, and I never really thought about it before, and it made me think, I was actually going to just do something totally wrong. And that's why, I'm not a doctor, But that's why you have to try to invest a little bit of your time and figure out how to take care of people's wounds. Let me make sure I got everything. Uh, that is everything. So basically, I just want to say once again, this is my idea of how I'm going to try to help and take care of people. I'm not telling you this is what you should do. I'm just giving you options. You have to have an open mind and always just listen to somebody. And then you take away from that what you want. You can say, I believe the whole thing's bullshit, or I like this idea, I don't like that idea. And you just expand upon that, and you make it your own. So I just wanted to give you a couple options, a couple ideas of how I would take care of things. A lot of times in these videos, you just see guys pull out something with brand names on it, tell you the brand name and the X47 whatever, and they don't tell you how to use it. They don't tell you none of that stuff. All they tell you is how much they paid for something. I mean, it's kind of like a popularity contest in high school with some of these bug out videos and other survival videos. I'm sorry I'm ranting here, but it kind of aggravates me. So I just thought maybe I'd give you my view on what I did with $1. You know what I'm saying? Some things I have are nice, but they do the job. That's all that matters. It doesn't matter the name brand on it. Okay, so next time, I hope you guys take a little bit of time with the trauma. I don't see a lot of bug out videos where people do more than pull out a couple band-aids and tell you how they're going to take care of somebody with some band-aids. It just doesn't work that way, guys. If we're going to take care of our families, who we love, and the whole reason why we're willing to bug out, we need to be proactive. We need to be the ones to step up. Okay, guys. Thank you. Okay, one last thing. This is going to be a quick addendum to the end of my video here. I noticed when I was watching it back that I forgot a couple items that weren't in my kit. But I'll show those to you real quick, and I'll also, one item I didn't mention. But there's a Bic lighter, you know, best for the quality, best for the price, a little Bic lighter. But basically, you saw I had some fire starting stuff here so you could boil water if you had to. That's what this is for. This is to start that fire nice and quick. Also, as a little contingency plan in case you run out, and let's say you bugged out for a long time and you have run out of iodine tablets. Well, you still hopefully will have your lighter. You can use that to sterilize your tools before you use them on a person. So that's why that's here. That's a little backup. It's got a couple of uses there. Quick clot. It's a styptic. A styptic bandage means it stops bleeding. Should have. I should have 2 of these. I only have 1 of these right now. I need to buy another. Put that in my kit, especially this being the trauma bag. It'd be nice to throw this down first and then add some gauze on top. But this is definitely should be in there. And then I have some ibuprofen and Tylenol. Little crazy glue bottle, keeps it nice and compact. You probably got 20 or more in here. A little bit less of the Tylenol because they're so large. But they fit in here really nicely. But you know, you have your Tylenol for your pain. You have your ibuprofen for your inflammation and your pain. But if you're going for straight pain, you want to use the Tylenol. You might want to give them an extra dose because all we have is Tylenol in my kit. We can all, you know, go out and get some Oxycontin or some uh, some other painkillers, Percocet, different things like that. We could all get them, but it's illegal to have them if you don't have a prescription for them. So I'm not willing to break the law and deal with drug dealers just to have something in my kit. Of course, it would be awesome to have that. Maybe scrounging, maybe that's something that scrounging later on in a bug out situation, maybe you can come across some and add it to your kit. But that was just the last couple of things that should be in my kit that weren't. And so that's the end of the video. I appreciate you watching. Thank you.